The firing pattern stuff is really important. It's a good intervention to use. But also, I just want to come back around to how do you work on some of these important structures more effectively. In the shoulder abduction, with any shoulder injury, particularly rotator cuff, but it doesn't really matter, the number one movement that gets lost is abduction.
With licensing or?
That or the whole Apley's. So that's why the Apley scratch test is important, because it looks at the combined actions of the shoulder for, if I reach this way, to be able to at least, now I'm limited, as I've said several times, people should be able to get closer to their elbow pointing to the ceiling. Yep, I'm off on a 45-degree angle, right? Everybody else I'm looking at is able to get their elbows more or less pointed up. So it should be, my lats are tight. This combined action, what is it? Shoulder flexion, external rotation, abduction. So it's all those. Then there's the other way. It's extension. Sorry, did I say external rotation? Yeah. Internal rotation, adduction. And then you get to compare the two. Like, are they able to? Yeah. Yeah. Didn't feel symmetrical. I think I was able to get there. But that could tell you something, that in that quick assessment, right, something in that plane of, those 3 planes of movement, or these 3 planes of movements, are inefficient. Now, the short answer here is that the adductors tend to be too short, and upper traps is always short, but that's the confusing part here is we're talking about ball and socket joint function in certain points of this range, but then there's the scapular functions. Now, if the traps and other stuff is so tight that it's changing where the scapulas are oriented, is that going to mess with how the ball and socket joint works? Yes. So starting out, especially if there's a rotator cuff injury or there's osteoarthritis, those are the things that would you would want to be a little bit more cautious. So better starting out to see if you can get the scapulas in better orientation. And if that helps the ball and socket joint, that's the better place for you to be throwing your interventions at it. Now the firing pattern sequence here, in the book, this one will get you, because palpating all this is my best shortcut for you, because in the book we have trying to palpate supraspinatus, deltoid, infraspinatus, middle and lower trapezius, and then contralateral lumbar area. Finding a way to palpate all that effectively is very tough. Now the seated position, you can see how she has her hand on the opposite, lower back and all that. To simplify this very much, let's go to B and D. Not D, it'd be upper trapezius, it's B. Just deltoid, this might be even writing in, if I had something for you to write in your book or something. The simplified rendition here, everything else is pretty easy. But here the simplified rendition would be deltoid, upper trapezius. Now come back to this, and being able to palpate deep to supraspinatus is important, but starting out, that may be harder for you to distinguish. If they tore supraspinatus, which is the most common rotator cuff tear that occurs, then that certainly would make sense that this isn't functioning appropriately, right? Now, the muscle though that should come in and take care of this in the anatomy lessons here, the pair groups of things, and I've happily, I know you've heard it before, but it's okay if it's been forgotten. You'll hear it again and you'll forget it again. The actions of the muscles are what make them paired groups, not always their orientation on the body. So it can be confusing that you look at the glutes, gluteus maximus, how it's centralized kinda on the posterior side, and you come over here and you see the pecs. Kind of similar shapes, one's below, one's above, but they're not paired. The action of that is more related to hip extension. The action of this is shoulder adduction. So the pecs and latissimus dorsi are your main shoulder adductors, whether it be this way, okay? Even when you see a press, don't pay attention to my elbows. What are my shoulders doing? They're adducting. There's horizontal adduction and then there's regular old adduction. But pec major, latissimus dorsi, adductors. So what are they paired with? The adductors. Glutes, and you have three glutes: gluteus maximus, gluteus medius, gluteus minimus. That's a little bit of what helped me with this. Gluteus maximus is more about hip extension and hyperextension. Medius and minimus are about abduction and a little bit internal rotation. So they kind of have, between the three of them, they do three-ish things around the whole hip joint. What's the muscle around the shoulder joint that covers the most area? From the front to the side to the back. It's deltoid. So deltoid kind of hugs the shoulder joint. The glutes as a group hug the hip joint. So glutes and deltoid. And any function at the relative to the hip and low back is always going to be that pretty much the glutes should be the dominant mover. Abduction, extension, right? For here on the shoulder, it's going to be deltoid should be the first mover, should be the boss. And just like everybody has an ornery low back, if their glutes aren't firing correctly, you have an ornery neck area if your shoulder isn't functioning appropriately. Now, that's broad terms, but you have an ornery neck if your scapula is out of like sorts, and then deltoid isn't like moving the ball and socket joint appropriately. Deltoid doesn't move the scapula, moves the femur. So it just simplifies it a bit, especially related to these common areas where people have symptoms. It hurts here. I'm going to bring the tone down there while encouraging better action in the glutes. We tend to hurt here. I can reduce the tension there while then encouraging better action here. So just a 2-for-1 kind of experience. So palpating, remember with upper traps where the belly of that muscle actually is. Like it's closer to the neck. Don't come all the way out here where it starts to feel bony. Okay? So upper trap, find the humerus. I think I said femur by accident. Humerus. Here we go. And then it's just lifting their arm off their side of their body. Back down, nice and slow. Again, nice and slow. That's a good old solid co-contraction. That trap is definitely overactive. So, now I'm going to show the thing that you would do, and I'll show kind of a shortcut here. The challenge here is that why is this short and tight? Is it short and tight relative to this action, or is it short and tight because we all just tend to end up with elevated shoulders? I tend to find that people are short in the upper chest because of just elevating their shoulders, not because the ball and socket joint of the shoulder is offset. It's just that we posturally end up here too much. Then that makes this less efficient. That would be different if the person had a torn rotator cuff. Like then you would want to be a bit more precise. So, but it's not too hard. What my action would be, I'm going to use a soft fist. I want to really reinforce how effective this can be. And we're going to talk about forearms here too. But just remembering that using this, you want your wrist to be in proper orientation. Don't radial and ulnar deviate. Set your wrist. Don't think, it should be that. The rest of your body needs to move to get this angle of contact to make the best contact you want it to. So I go here, I go, no, no, up. So that I don't have to change my wrist. I just keep finding a way until that angle of my knuckles fits where I want it to. There you go. Exactly. But where people do this wrong is they'll keep on tweaking their ankle around to get their knuckles feel like they're fitting. So once you're making contact, there we go. Now all I have to do is, okay, little lift. Go down nice and slow. Gravity is creating some resistance here already. And with her, to be honest, this is activating more than I anticipated. So this really might be more of the issue. A little bit again. And kind of agitate deltoid. Good, let go. And then again. Ah. You see how much quicker and free that was? Back down, nice and easy. That's about as good an example as I can show. That it suddenly looked and felt so much easier to do, and that correlated with a softening from my palpation.
So you're basically trying to get the person to not potentially do this.
You got it. Yep. That they're overly activating elevation of the scapula.
Yeah, it shouldn't. It's like coming up, it should not be necessarily activated.
Yep. And there's two benefits that occur with doing it like this. One is that any pressure here is holding the scapula down. You're forcing the scapula into depression. And you can't, you're doing that anyway. So just by doing that, even if I just held it down, had a person do the action, that's probably going to help a bit. But then we get 2 for 1. I force the scapula in better orientation. I inhibit the muscle that's pulling it out of correct orientation. And then I have them do the motion, trying to teach the muscle that should be the prime mover of the shoulder joint proper, the ball and socket joint, to activate better. And if we could just teach that as the blueprint, because this is supposed to be our more ideal normal. It's more like a reminder to the body. Like, remember, this is how you were designed. My joke, it's not a good joke, but the thing is that we kind of beat nature. We allowed it to turn into a situation where we're not always using our bodies the way they were correctly designed. They're like we made, comfy couches and computers and stuff like that, right? So now, a bit of a shortcut to some of this. That can be the intervention that you do. In this case, it felt like it was probably a really good one. The other is just to go right to the elevation depression action. And if the shoulder is really screwy, then I say do both of these, okay? There's one that's holding trap down, activating deltoid, that's the firing pattern one. Now it's gonna be about trying to get the scapula in better orientation. And everybody needs this one, where it's holding upper trap down, and levator scapula, if I can find it. That's where if I decide to push on something, I try to push on where there's like layers meeting, and that also means like layers sitting on top of each other. So here's upper trap, there's levator scapula. And what does levator scapula do? And upper trap. So why not squash both of them? It can be a bit more posterior, so you see just how far over they are. Don't be over here, be right there. People get scared with neck stuff, is they end up coming over too much. In this case, I may have to ask her to roll a little bit forward for me. Let me keep the arm on the side, there we go. Now, and I might encourage that. I don't want to be here, I want to be here. So my elbow angle is much more flexed so that my pressure is a bit more posterior. not lined up right here. So not this. That. Now, what action do I have to have him do?
Shrug.
And then, this isn't quite firing pattern stuff, but if I have a person shorten what I'm pushing on, then I'm inhibiting its action to shorten. But if when they lengthen it, I'm actually encouraging it to lengthen, right? So they get two signals, me pushing on it and them actively eccentrically contracting it to encourage the tissue to lengthen. The antagonist is not being pushed on. So it's a conversation between the muscles, the agonist and the antagonist. So let's say biceps are just stuck short because I'm just so strong. But this is too short. I push on it, inhibitory pressure. I have them concentrically shorten it, then I have them eccentrically lengthen it. But this is also concentrically shortening the antagonists, the triceps, and trying to get that equalized. Like you guys should be equal in how you control the elbow. So just from saying you're too much, so then you need to kick on. It's not quite firing patterns, it's agonist-antagonist relationships. But this tug of war needs to be balanced. For the scapula, it's the lower traps. It's a weird thing with trapezius. You learn trapezius is one big muscle, right? But look at the fiber orientation here. The fibers of upper trapezius go more upward. The middle fibers go more transverse. The lower fibers go more downward. So these three segments do very separate things. They can all work together in some actions, like I'm just standing up or moving my neck, like both upper trapeziuses would do that. But if I do like a side bend, a lateral flex, one side has to shorten while the other side lengthens. On the same side, with a scapular movement, if I elevate my shoulder, my scapula, upper trapezius shortens, lower trapezius lengthens. If I flip that with the better, the good side of depression, God, you gotta tuck your chin in and try to bring the scapulus down, and it should feel like you're activating here. That's activating lower trapezius. Upper trapezius and lower trapezius are antagonists for scapular elevation and depression. Isn't that nifty? And knowing that's great, but ultimately the action just turns into, it's important to know how to shorten it, but let's encourage the correct orientation by having them just reach for their toes. And what a sensation that creates. In terms of this area feeling like you're working on it effectively, actively lengthening it has that deep stretch myofascial thing that really, anybody that wants intensity, this is what you go to, especially in for a neck shoulder area. So let me do it with a forearm. I like using the forearm because I can even create some additional resistance on the scapular elevation. I go here and to get my orientation better. Table's just a little low, but not bad. So here, pressure.
Good.
About good. So a little shrug up. Doesn't have to be too big. And slowly let go, and then reach for your toes, look for a nice deep stretch. And that's all it is. Let go, nice and easy. Okay, shrug. And reach for your toes. Good, good. Let go. All right, I'm gonna have you lift your arm off the side of your body like you're trying to make a wing. There you go, down, okay, again, and down. Wow. And both of those things got super. I didn't have to change my position, but one was scapular elevation depression, and the other one's about shoulder abduction. And it's doing that, regardless of what the source of it was, tended to be just one of the best go-tos I could think.